published article out there now that says that 50% of revenues to most pediatricians come from vaccines. And then there's a whole structure where Blue Cross and the other insurance companies pay bonuses to the pediatrician to make sure, if, for example, 95% of if their clients are fully vaccinated, they get a huge bonus. It could be tens of thousands of dollars. And that's why your pediatrician, if you say, I want to go slow on the vaccines or I want to have a little different schedule, your pediatrician will throw you out of his practice because you're now jeopardizing that bonus structure. And these are all perverse incentives that stop doctors from actually practicing medicine and caring for the client because they're looking at the bottom line.
Hi, my name is Dr. Rubin, and RFK Jr. is lying to you again, and I strongly encourage people to point out his lies and stop calling it misinformation because he manipulates information and purposely lies to push his own agenda. The fact of the matter is that there's no study that exists that actually proves that pediatricians make half of their salary off of vaccines, and that is wholly ridiculous if you think about what actually happens when it comes to vaccines. So what happens is pediatricians will order them from a vaccine manufacturer, and then when they administer the vaccine, they will bill insurance companies for the vaccine and for the administration. And there are studies, including one by the CDC, that show that the amount of money that pediatricians make from vaccines barely cover the costs for the overhead. Because it's not just a matter of giving vaccines. You've got to pay your staff, you've got to pay for storage and handling, and insurance companies barely cover those costs, especially with Medicaid. Pediatricians make almost no money off of it, and it's really more of a net loss. And it's definitely a net gain from a public health standpoint because we are preventing severe illness, hospitalization, and death from these life-saving preventive measures. Also, it's really offensive for RFK Jr.'s Health and Human Services Secretary to constantly degrade physicians, especially pediatricians who care about children's health, and saying that they make tens of thousands of dollars in bonuses from these companies when that doesn't happen at all. And they're one of the lowest paid specialties in all of medicine when you look at the grand scheme of things. So show your support for your pediatrician by writing a comment about your pediatrician and sharing this post widely.